Next speaker is already sir mentioned about Dr. Surobhi Chatterjee. She is a young medical graduate and she is doing her post graduation at All India Institute of Medical Sciences, Andhra Pradesh. And she completed her uh, undergraduation from King George Medical University. And she published so many reputed articles in the reputed journals like Lancet and Global Psychiatry, renowned journal. She has more than 30 publications to her credit, and she presented con- at various conferences at national level as well as international conferences. And I can say that she can be the inspiration for many of young scholars or young graduates, those who are attending here. And I'm happy to invite her to present. This topic is very useful, and this is the need of the hour. And AI used by medical students in Indian perspective. I welcome Dr. Surabhi Chatterjee for the presentation.
Hello, am I audible?
Yeah.
Thank you so much, sir, for such a wonderful introduction. So now I'll be presenting my slides. Is my slide visible?
Yes.
Yes, visible.
Okay. Hello, everybody. I am Dr. Surobhi Chatterjee, and as sir mentioned, I am a resident in training and doing my MD psychiatry training currently from AIIMS, Andhra Pradesh. So the topic for today's presentation is artificial intelligence used by medical student, and I'll be describing both Indian as well as a global perspective on understanding the power and the potential of artificial intelligence and what it holds for our future. So first, disclosure that whatever I have, this presentation actually has used AI, and for that I have already put a disclosure before here. So one of the things that I'll also be covering is that it's important that whenever you are using AI, you're also covering the disclosure portion. So first we'll begin with understanding what is artificial intelligence. So artificial intelligence is basically utilizing the way human intelligence works and combining it and training the machines which are used, particularly the computer systems, so that they are able to perform complex tasks that would usually require the reasoning, the logical ability, and the problem solving, which is usually we call humans for. So there are several uses of it. One of the most useful forms that we are all using these days is generative AI, and I'll explain how generative AI has developed over a period of time, which includes decision-making algorithms, chatbots. There is patient and care systems which are used across the globe now, which conglomerates all the data which is used for patient care. There are digital assistants as well, and medical students are using it for every bit and now for using, may it be their thesis work, may it be their simply writing something, searching topics, so on and so forth. So first we'll focus on how did these AI actually develop over a period of time. So in the 1950s, during the time of Alan Turing, when he first said that what if we can make machines that can actually think? So beginning from that concept, wherein initially there was data sets that was given and simple tasks like, for example, playing chess, and on a rigorous task, which is a uniform based task, if it was given to the machines, they could do that. From that, we have gradually developed to learning deep learning system, which is based on the neuronal function of how human works. And now 2016, when Google first launched its AlphaGo program, to now, as we all know, the launch of ChatGPT and the generative AI. So AI in medical education is basically described in these three formats. So first is about the learner-oriented AI, where we actually focus about the medical students, the trainees, the postgraduate trainees across who learn and use AI to receive and understand the new information. Then AI can also be used by instructor themselves for improving and enhancing the level of discussions they are doing, for gaining new knowledge and improving their presentations, and also for checking and tasks which are more rigorous. Later on, there is something called as institution-oriented AI, which is basically focused upon administrative work and how the patient care could be improvised, how the inventory management could be done, and how the data could be secured in a much easier format. So now, as I told you, I'll be describing how artificial intelligence initially started. So if you can look in the here. So first, it was basically machine learning. So in machine learning, what happens is we first allow the systems to learn the patterns. So say, for example, uh, if you have to learn between machine learning is described in the form of supervised and unsupervised learning. So what does supervised learning actually means is that, say, for example, you have to train a machine system on the basis of how to differentiate a data set. I'll give an easy example and then we'll proceed it to psychiatry. So if you have to ask a machine to train on the basis of identifying images, if an image is of a cat or a dog, so, on the basis of facial features, on the basis of their whiskers, the eyes, the kind of eyebrow, the kind of ears they have, those are the different differential features that the machine will recognize, and each of them will be extracted as a data point. Later on, this same data will be used, and that is called as the baseline data or the ground level data. On the basis of that, the AI learns how to differentiate. Now, an AI is as good as the data that you given. That is why the concept of GIGO or garbage in, garbage out, which means as rigorous and as well validated data that you use across different setups. On the basis of that only, your machine will be able to learn and recognize it and then give a correct output. Next is the deep learning system. So deep learning system actually recognizes the neural networks and the neural framework that humans also use. So for example, there is first baseline data, then there is hidden neural networks, and then the final output. And finally, we came to natural language or large language models, which we now use in the form of generative AI. So generative, the term means that now the AI can learn through the natural language which humans use. So it's validated across several languages. You can use it in an easy conversational tone, and it will generate something for you, maybe in the form of some text, some images, some video content, some code-based content, based on already validated and pre-trained data that it has been used. And the most common examples that we use these days is ChatGPT or Google Bard system. So this is what the supervised and the unsupervised learning that I was explaining just before this is. So on the basis of supervised learning, this is how our data will actually differentiate. So say, for example, if now you have to provide the same data and move it to psychiatry, if you have to understand what are the certain features or certain markers that can help us differentiate if some person has psychosis or not. So all those differential elements, be it from their cardiovascular to their neurobiological markers, each of them will be trained on a different set point. And this is what the AI will learn. So that is why whenever, even in generative AI, a person giving us a person requiring same answers, when different students put in different queries, the answers which are generated are very variable, because the AI also learns on the basis of the previous questions and the previous kind of information that you have fed into the system. And this is how the system of deep network works. And I'll be explaining why it is important to understand this so that you can understand what are the pitfalls or the drawbacks of AI. So this is deep learning model. So similar to our neurons, this is the input layer, and there are several hidden layers through which the data is generated and is cross-connected. And then finally, all those individual global data points are pooled and given into a concentrated layer. Now what happens is sometimes we cannot go back and identify how did the information actually come in place. And sometimes, especially both using generative and deep AI, we cannot understand why the system has predicted that one person can have, say, for example, psychosis, another person cannot. And that is what leads to the black box phenomenon. So now, what are the real world applications of the AI? So what does the actual data says? So this is one of the studies which was done in 2022 by Chen et al. And he did across physicians and medical students. And he found that in the future, most of the respondents, around 60% of the respondents in the 10 different studies that they included, they were willing to incorporate AI in some of the other forms. So we can see that the future actually encompasses AI, and it's AI in the future. If we don't use it, we are bound to get we'll perish if we don't use it. So we see that most of the respondents, and one of the startling finding was that most of the people from low middle income countries were more willing to use AI in their clinical practice because of the hectic workload that they are facing or the less amount of resources that has been allocated, because AI is making their work very easy. And because one of the findings of the study also said that as most of the us are worried that will AI ever replace humans. So in this study also 68% people agreed that physicians will not be replaced by AI in the future, and it still requires AI will still require physician autonomy. Even in branches like radiology, where it was said that AI would completely replicate and would completely physicians will go out of use. It's said that because AI can generate a lot of faulty data, so it's very important to be cross validated, and physicians will always and always be important. So, what are the different uses in which clinicians can use it, for example? So, in generating evidence based medicine, to understand what are the different kinds of evidence that is being generated, keeping ourselves abreast upon it, for creating personalized medicine targeted to a group of people, and for patient data and inventory management. For patients, they can use AI for making informed decisions, even in the aspect of preventive healthcare. There's a lot of AI now being developed for community services, wherein because now it uses large language models through easy languages, people are able to understand and prevent. So one of it was also successfully developed in Africa, where they prevented the spread of malaria in certain parts. So again, then we saw that among medical and physicians, 65% had awareness on what basis they can use AI for, but most of the knowledge they also felt was more superficial. They lacked deeper insight into how AI works. Around 10 to 30% had already been using clinical AI in some forms, and though it's usually said that medical students, but there has also been a significant uptake of AI by physicians, and sometimes more than that of medical students. In Indian context, when the study was searched, it shows that there was a higher usage in Indian context as compared to a global average. More than 60% of the mental health professionals in our country have agreed to using AI in some forms, maybe for generating answers to their clinical questions, for using it for finding research questions, or for simply providing patient instructions. So the next form of use belongs to it, the research. So AI has been used for doing literature review. You can go through several papers and generate network maps. You can use it to generate questions for hypothesis and for simple works like low-level works like editing or validating, or even using it for creating your data sets. And in education, as we know that there is transformative use of AI that is being done now. People are using it for chatbot assistance, so that especially in higher level education after 10th and 12th, people are using it to answer questions related to the fields of science and STEM branches. So now these are some of the examples that I have included. So why are we using artificial intelligence? So first of all is it increases the efficiency. So especially in repetitive tasks, though we say that human mind and everything is derived from it, but we tend to slow down when there's something which is being done repetitively. But that's the benefit with artificial intelligence and machine, that they usually don't tire up easily, and they reduce the time which is taken to generate something. So say, for example, this is one of the example called as MindGrasp. Here, whatever lectures that somebody is giving you, maybe it on a video format or live lectures, you can have it recorded. It will transcribe everything for you. It will create small, and if you give all that transcript material to it, it will generate quiz for you, flashcards, notes for you, so that you can use it in your studies. Another example is GoBoat, which is a free to install app. It also creates similar things, quiz on the basis of the materials that you have learned. The second important thing is AI reduces human error. So, if we see generally, if humans tend to do things multiple times, that I already said, they get exhausted and there's chances of human error. Now, going back and manually doing all that work again is very time tasking, and it's not that time efficient as well. So herein what AI can be used in order to check and supervise and recheck and edit the data. And third, for automating whatever repetitive task is there. Then one of this AI system is called the Genie AI, which also I have used for the presentation, wherein you can understand, you can summarize whatever research papers you are doing. It will help you organize the research. It will help you find similar research data that you can use.
You stopped.
Hello,
Dr.
is it
Surabhi?
visible now?
Yeah,
Okay.
yeah, you can continue.
Yeah, okay. So next is we saw that how now we come to the Indian perspective and how medical students have been using it. So there are several studies which are done in this regard. One of the studies which was published by Nadia Ahmed et al. On a cross-sectional study done in Jharkhand, where she explored how medical students in India were using artificial intelligence. She found that 80% of the students felt that some kind of bias would actually reduce, and while they do the work there is more bias in the writings and the answers that they are producing. But on the other hand, they felt that whatever assignments they were given to them, they only had superficial knowledge of it because they were using AI to answer them around so another point that found was that AI training and self-assessed knowledge, most of them were using AI to answer questions in their assignments, in their homeworks, also in exams at times. So they felt that it was important to understand that even uh, exams like this, even generative AI could generate very faulty answers, and which was not understood by them. The other point that came out by another study by Preeta Jackson et al. Was that AI training in the self-assessed knowledge. Around 91.4% medical students said that even though they used AI, they had no formal training, so they didn't understand that what were the repercussions of using AI, both in their curriculum as well as in their research. Even 35% said that now, because AI is playing a very prominent role, it could also influence the specialty that they are going to take in future. The next point was about competence and confidentiality. Around 26.8% felt that they were competent enough to be informed about AI. And most of them, around half of them, were unsure that if by using AI they are protecting patient confidentiality or not. Most of them agreed that AI actually helps in reducing errors in the medical practice, and it makes them more well informed about accurate decision making. Instead of going through several textbooks to find the answer, they could find all of them and find an answer which is generated, and then they could cross validate it. There's another study which was done which found that, especially in America, an American Association of Medical Students has also called for it, that it is a very high need that there is curriculum inclusion of AI in our studies, so that medical students are also abreast upon what are the different things that they can use, and more so than that, they understand the disadvantages while using AI. Because most of the curriculum across globe lacks such support, especially in low middle income countries. So around 75% of people have supported that there should be structured AI training in medical education. So, what is India's medical landscape and what is the AI being used these days? So, if we come to India, AIMS, KMC Manipal, JIPMER, these all institutes of national importance and KMC Manipal have come together and built and used Microsoft actually to create an Elsevier to build virtual cadaveric dissection labs. So they can actually go inside, they can actually visualize each part of the heart, how it works. For example, they can see the blood vessels, they can see everything in a 3D orientation, and the dynamic working of the body could be understood better. So it also reduces the need for the bodies that are required for cadaveric dissection. As of now, both of them are going simultaneously in some of these institutions, and some of them have completely shifted to virtual cadaver for anatomy discussions. Then there is AI patient avatars and VR sets, which are actually being used for simulating psychiatric cases. So they are role play modules which are given for people who are having panic disorder, for patients with phobia. They are used and they are placed on patients, and they have shown significant response after using these AI systems, both in Apollo and KMC. There are also virtual reality surgery modules which are coming up, wherein for teaching surgical training to residents as well as for medical students, especially suturing techniques and all, they are now using VR surgery modules, so which replicates a very true feeling of the materials, and the person actually feels that they are in the heated set of an OR without actually going in an operation theater, and they can see the functioning there. There is also, as I mentioned, significant use of chatbot now in community medicine, and JIPMER has come up with a pilot project on it. AIMS Delhi has started several radiology modules along with that, and on 10th September, it launched this Never Alone app that you can see here in collaboration with one of its alumnus, Dr. Deepak Chopra, which is an AI-driven app which will now provide 24 into 7 screening, counseling, intervention, and follow-up for students who are coping with stress and who are having suicidal ideation. So now what is the global medical landscape as for AI? In India, as we are seeing, there's not any dedicated AI learning that is being developed. There is one of the few projects which are still in pipeline. One of them is like between KG and IIT Nagpur, IIT Kanpur, where they are thinking about creating and including AI in their innovation landscape. But what globally we are seeing is institutes like Harvard Medical School have already started a dedicated semester in which they have a dedicated AI centered curriculum in the first semester itself of medical students, so they can learn the basics of AI and what are the pitfalls of using it, how to use it. And there is also supervised training method. There is an MD PhD that you can get called as AI in medicine, and a different PhD track is also created. There's some free CMEs also, like AI in family medicine, which is being given. Stanford has started its 100% online artificial intelligence in healthcare program that can be taken. There is University of Illinois, again, which has started certificate course, which again helps in understanding how AI could be used, how we can generate new chatbots, uh, new machine learning tools in the future, which will integrate both the working and the capability and the understanding of physicians use, and will be more data driven. So evidence-based medicine as well as the physician autonomy could be increased further using these chatbots. And similar, there are certain chatbots which are coming up by the University of Lancashire using their specific course using artificial intelligence in healthcare. So some of these tools I have covered, which I have also used, and they are used by several medical students across the globe. So there are some of them which are free tools and some of them which has free and subscription-based services. So say for example, I'll just cover briefly a few of them. So there's a very famous tool called as Anki, which is already very popular in people who usually pursue exams in US. For them, it's basically a flashcard-based tool. Now it also is coming with the AI bot, which can be included. And similarly, by giving it all the materials and the transcripts, instead of you generating flashcards, it would generate flashcards for you. Similarly, a free tool is Heuristica, which could be used for the similar thing. Concept maps could be included. Medical students can help integrate what we are also trying through the now vertical integration and the horizontal integration of the subjects. Similarly, there is something called as AI Blaze, which could be used for homework. There is MindGrasp, similar for using lecture recordings, scanning all the textbooks and generating summaries. And then there is something called as Unriddle, which can help you write in papers and simplify complicated texts. There are also some of the tools which is indigenously built in India now. Say, for example, Q.ai has helped provide medical imaging interpretation. So students can upload chest x-rays, CT scans, MRIs, and a brief interpretation of the same will be given through these apps. One of the very famous apps before there was the coaching industry and there was so much upheaval of the online coaching platforms, there was something called as daily rounds, wherein free case-based learning was provided to medical students and they could upload case and they would be provided with answers for it. Similarly, there's very good tools like Imbibe and MyUpchar, which is for patient content, wherein they can put in information regarding any language and they'll get the answer. These are some of the more tools which they can use. But what is more important to understand is the pitfalls of the artificial intelligence. So these are some of the examples. Say, for example, in MIT, they have recently started that they retracted one of their papers on artificial intelligence because it was completely written by using artificial intelligence by a doctoral student. There's a recent study where Vietnamese students, it was felt that most of them were using it for using ChatGPT. They were using it for their assignments. Even there's several papers. Springer has recently retracted because there was AI generated content in it and they could find exact chats which were quoted by ChatGPT in those published papers. Similarly, in other countries as well, we can see that senior academics were also investigated on their texts being written by ChatGPT, and several preprints included, and there were several papers that had to be retracted because of it. So there's four important pitfalls when we come to artificial intelligence. One, as I said, that how the data is generated, it is very difficult to understand it. So there is opacity, data privacy, there is issue, reliability is one of the issues, and fairness, so that we can understand that it is not excluding certain set of data. There's something which is called a pseudo generation or AI hallucination, which most of the students are not aware of. So sometimes when you give prompts to AI, it will give you answers on the basis of the question that you have generated. But when you go back and cross-validate those papers or those text materials, they are actually non-existent. So that is something which is called a pseudo generation. And the black box nature of AI is, as I explained, you cannot understand how the data was generated or how that faulty assumption was made at the initial place. Third is there's plagiarism and people are using that intact AI text. They are not even and using papers. They are plagiarizing the entire data and using it in publishing their own work. By using AI, they are severely compromising the research integrity. So ICMR has come up, I have put it in last. Basically, ICMR has come up with so many guiding principles that could be used in order for that accountability and data privacy rules. And for guiding, it's basically a 27 pages long document where they have included what are the recommendations and how we can include it. So this is the entire ethical checklist that they have put forward that should be followed by everybody who is doing biomedical research and healthcare. And one of the new terms they have included is right to be forgotten, so that a person, if they want, their data should be completely removed from the patient care data if they want it, which should be a right that should be provided to the patients. Similarly, again, this is again a 12 pages document by the American Association of Medical Education, who have come with curricular recommendations of how different sets of curriculum can be included, what is the foundation for it, how the benefits can be explained, how the 4 V's of big data, the volume, variety, velocity, and the veracity of the data should be explained. And it has come up with like 14 modules of it, of how each of these modules could be included in the studies. So finally, I would end my presentation by saying that AI is definitely growing and there'll be wider integration of AI. So it is supposed to grow further and grow very fast. And so it's important that there is closer collaboration. And finally, there is curriculum inclusion. You can use this to read all the papers that I have quoted for further reading. Thank you.
Thank you, Dr. Surabhi, for a nice presentation. And she presented even global scenario as well as Indian scenario and the major chatbots used in India in medical education. And anyway, AI cannot replace human beings, but but definitely it enhances the quality of medical education, clinician teaching in all the aspects. That is the take-home message. But right now, even if anyone from the audience having any questions, can ask the questions to the presenter. If there is any question, please ask quick because we are running behind time.
Yeah, maybe you can ask. So what, let's say it that way, we are just very, very difficult path. And I think if we said, since maybe less than 10 years, AI has changed an awful lot. So what's going to have to be, what would you predict in medicine happening in 10, 20 years? So will there be another complete change of AI? So how can you have a look at in the future?
Thank you, Dr. Reina, for your question. I definitely think that there will be wider integration in both curriculum, because now, as even American institutes and even Indian institutes are putting forward, maybe it will be made a different pathway altogether. We can use AI, and instead of blaming AI, maybe we can work in joint collaboration with it. Especially, we are seeing so many research paper where now it's been being mandatory to declare the use of generative AI. So similarly, there should be more methods that should come forward wherein people can tell if they've actually used AI or not. And I think that is the way forward. And clinicians, they should be more updated about AI, as well as they should be more ready to use it, because there's a lot of resistance, especially in people from previous generations, to use it. And so I think using both of these will help.
Can I just say from my experience as an editor of Global Psychiatry Archives, we get more and more papers which are AI generated, where the methods are more or less from the quality of a magister paper or an MD paper, but so it's very often that the statistics is over-explained and overused. And I think that's a worry at the moment for me as an editor. Do you want to comment on that?
Yeah, sure. Because as I mentioned also, there's several papers now. They have shown that around 20,000 papers every year are written using AI, and the level is very variable. Especially like you mentioned, so many words that they are actually using, they are being repeatedly used. For example, statistics or deepen, delve, terms like this that AI tends to use a lot, and sometimes the content that will be generated will be so difficult to understand that both the authors, the editors are at a fix to understand. And I think that's why also plagiarism tools are coming up, which have also included an AI driven tasks like papers like in Turnitin, you can find how much is the plagiarism. But as that are coming up, even people are surpassing that and using other tools to catch up with this AI tool. So I think that's why we, as researchers, people who are editors of the paper like you, we need to develop frameworks and stronger check tasks. It is our task to like put a check hold on all of these methods that they are using, maybe by using better technologies. And that's why it's important that we work in close collaborations with people maybe from the data scientists area as well.
Okay.
Definitely, there are challenges, as Professor Rana mentioned. Yeah. Any other questions?
I can see one question here by Dr. Ipsita, who has asked, could you please guide us as to how to choose which AI platforms we should use and how to ensure reliability? So, as I mentioned, that it's not just about the tool that you're using. Some of the tools I have mentioned in my presentations, but all the AI tools, irrespective of whether they are free, they are subscription based, whatever tool, they have this tendency. They can still be that they're generating the data that they're generating is faulty. So it's always and always that I tell to everybody that whatever papers you're citing, even using ChatGPT, go back, search that same paper. Is it available, say, for example, on PubMed? Is it available on Google Scholar? Because so many times they hallucinate, they create authors which are non-existent, or authors who are not in that field only, and those papers are generated. So I would say that it is, again, it's our responsibility and our duty as a researcher to cross-check and validate before we present the data and use that data anywhere else. So it's not that one tool can help you.